Okay, hello. Second. My name is Will Herrick. This is my biochemistry case connections, unit 4. So we have case 1. Case 1 starts with a 58-year-old woman presents to the emergency department with progressive fatigue and weakness for the past 6 months. She is short of breath after walking several blocks. On review of systems, she mentioned mild diarrhea. She has noted intermittent numbness and tingling in her lower extremities and a loss of balance while walking. She denies any other neurologic or cardiac symptoms and has no history of black or blood stools or other blood loss. On physical examination, she is tachycardic to 110 BPM and other vital signs are normal. The head and neck examinations are notable for pale conjunctivitis and a beefy red tongue with loss of papillae. Cardiac examination shows a rapid, regular rhythm with a grade 2 out of 6 systolic murmur at the left sternal border. Neurologic examination reveals decreased sensitization to light, touch, and vibration in the lower extremities. No depression noted. The hematology consultant on call is asked to see the patient because of a low hematocrit level. Megaloblastic anemia is suspected. Which of the following vitamin deficiencies is the probable cause for this presentation? I will discuss each option and note which one is correct and which two are incorrect or least likely. First, the correct answer, vitamin B12 deficiency. This deficiency is known to cause the suspected megaloblastic anemia and has a significant neurologic component. The symptoms found in this tend to be fatigue, weakness, and neurological symptoms such as peripheral neuropathy. This can align with the patient's numbness they mentioned, along with the tingling and balance issues. Other things that point to this area are the beefy red tongue and presence of anemia, which is indicated by lower hematocrit. B12 is important when making DNA and forming red blood cells. When you don't produce enough, you can produce red blood cells improperly and cause them to be larger than usual. Incorrect answer 1. Iron deficiency. This deficiency typically presents with microcytic hypochromic red blood cells rather than the macrocytic, which are seen in megaloblastic anemia. The symptoms of this deficiency include fatigue, pallor, and shortness of breath in severe cases, but not any of the neurologic symptoms seen in this patient. Neither the beefy red tongue or the specific neurologic deficits are characteristics of iron deficiency, allowing us to rule this option out. Incorrect answer number 2 is vitamin B6 deficiency. This deficiency does not typically cause megaloblastic anemia, but rather can lead to sideroblastic anemia. Although it may result in peripheral neuropathy, this condition is not usually associated with the prominent hematologic findings that this patient had. Other characteristics that do not match this deficiency include the beefy red tongue and megaloblastic changes, or neurologic symptoms, allowing us to also rule this option out. Okay, we move over to case 2. Case 2, we will have 3 separate scenarios, and for each scenario, I will determine the most likely enzyme deficiency and which amino acids are no longer metabolized. I will do if any amino acids become essential as a result to the deficiency, and I will say potential vitamin supplements that may be useful for the condition and what steps in the metabolism they could potentially help with. Scenario 1, a full-term girl who was born with a normal delivery and was released from the hospital at 3 days of age. At 9 days of age, A screening test for branched-chain amino acids came back positive, and the child was readmitted to the hospital for further evaluation. There was no history of any genetic disease in either family, and both older siblings were well. The enzyme deficiency in amino acids no longer metabolized. The enzyme deficiency for this scenario is most likely branched-chain alpha-keto acid dehydrogenase deficiency. The accumulation of branched-chain amino acids is typically found in this condition. The amino acids that cannot be metabolized effectively are valine, leucine, and isoleucine. These are also the essential amino acids. This is because the body cannot properly metabolize them unless proper diet is followed, although we are dealing with a 9-day-old infant, so the scenario is different. A potential vitamin supplement that would be beneficial is thiamine. This is because it is a cofactor of several enzymes in the metabolism of branched-chain amino acids. Improvement in the activity of residual enzyme function is seen after supplying thiamine. Scenario 2. A 69-year-old woman presented with a 30-year history of lower back and large joint pain of the hips and shoulders. On examination, blue-gray pigmented macules were present over the cartilaginosus portion of ears and on the sclera. Past medical history include aortic stenosis. So the enzyme deficiency suggested in this is alkaptonuria, caused by the homogeneous oxidase deficiency. The metabolism of phenylalanine and tyrosine are affected and have excessive amount of homogeneous acid accumulates due to it. Essential amino acids include phenylalanine due to its role in producing tyrosine. Potential vitamin supplements include vitamin C. This is because vitamin C ability to reduce the levels of homogeneous acid by promoting its excretion. This can mitigate symptoms of alkaptonuria. Okay, scenario 3. A 4-day-old infant is being followed in your clinic. Her birth weight was 5.9 pounds and the pregnancy and birth were normal. Results from newborn screening demonstrated a phenylalanine level of 6.6, much higher than normal. The enzyme deficiency is likely phenylalanine hydroxylase enzyme. This leads to phenylketonuria. This amino acid affects are the metabolism of phenylalanine, preventing its conversion to tyrosine. Essential amino acids include tyrosine due to the body's inability to convert, and the potential vitamin supplements include BH4, which is a cofactor for phenylalanine hydroxylase. In certain cases, BH4 supplementation can enhance enzyme activity and improve phenylalanine metabolism. Okay, thank you guys so much for watching. Drop any questions you have in the comments and let me know.